One of the world's most lethal conditions can actually be detected by tasting a patient's pee. That's right, people with uncontrolled diabetes have pee that has a distinct sweet taste. In fact, the technical term for diabetes mellitus, comes from the Latin word for sweet like honey. In the 7th century, an Indian physician by the name of Sushruta wrote about the sweetness of urine in diabetic patients. But it wasn't until the 17th century when a British physician by the name of Thomas Willis rediscovered this sweetness that was in the pee of diabetic patients. And at that point, the term mellitus was added on to the end of diabetes. But did you know there's actually 2 kinds of diabetes, and they're actually quite different? So what's the difference between the 2? In the next little bit, I'm gonna give you a little overview of type 1 diabetes, which is a disease that affects almost 2 million Americans. And then I'll give a little tip that can help manage their condition. Type 1 diabetes is often diagnosed in early childhood. It can't be prevented and it can't be treated either. It's known as an organ-specific autoimmune disease, which means that your immune system is specifically targeting the pancreas, which is the organ that makes insulin. And insulin is an incredibly important hormone that allows sugar from your blood to flow into your cells. When your body can't produce enough insulin to help sugar flow from your blood to your cells, your blood sugar skyrockets and you end up with all sorts of yucky side effects. It has a lot of implications for your overall health, but in the moment, when a diabetic has high blood sugar, they end up feeling fatigue, headaches, nausea, excess sweat, rapid breathing, and if it's too high for too long, ketoacidosis. And the craziest thing is that it's such a delicate balance between too much insulin and not enough insulin. And sometimes diabetic patients who use insulin can actually misdose and use too much insulin and end up dropping their blood sugar too low, which can also cause altered mental status, fatigue, slurred speech, confusion, and in some situations, it can actually knock out their respiratory drive. Most type 1 diabetics follow strict nutrition plans in order to manage their condition. But from what I've observed, one of the easiest things that a type 1 diabetic can do to help manage their condition is to make sure they're getting adequate amounts of fiber in their diet. Numerous studies show that getting adequate amounts of fiber helps to balance your blood sugar, especially when consumed before fat, protein, and carbs. And since eating a salad or a handful of nuts before each meal is rarely convenient, I always suggest supplementing in order to bridge the gap between what you're getting and what you need. So if you know someone who's type 1 diabetic, send this to them and tell them to let me know if I missed anything, and if they've heard this fibery tip.